Dissociative identity disorder, previously known as a multiple personality disorder, is an effect of severe trauma during early childhood, usually extreme, repetitive physical, sexual, or emotional abuse. What is a dissociative identity disorder? Most of us have experienced mild dissociation, which is like daydreaming or getting lost in the moment while working on a project. However, dissociative identity disorder is a severe form of dissociation, a mental process which produces a lack of connection in a person's thought, memories, feelings, actions.
Is dissociative identity disorder real? You may wonder if dissociative identity disorder is real. After all, understanding the development of multiple personalities is difficult, even for highly trained experts, but dissociative identity disorder does exist.
What are the symptoms of dissociative identity disorder? Dissociative identity disorder is characterized by the presence of two or more distinct or split identities or personality states that continually have power over the person's behavior. With dissociative identity disorder, there's also an inability to recall key personal information that is too far-reaching to be explained as mere forgetfulness. With dissociative identity disorder, there are also highly distinct memory variations which fluctuate with the person's split personality. The alters or different identities have their own age, sex, or race. Each has his or her own postures, gestures, and distinct way of talking. Sometimes, the alters are imaginary people. Sometimes, they are animals. As each personality reveals itself and controls the individual's behavior and thoughts, it's called switching. Switching can take seconds to minutes to days. When under hypnosis, the person's different alters or identities may be very responsive to the therapist's request.
Along with the dissociation and multiple or split personalities, people with dissociative disorders may experience any of the following symptoms: depression, mood swings, suicidal tendencies, sleep disorders, insomnia, night terrors, and sleepwalking, anxiety, panic attacks, and phobias, flashbacks, reactions to stimuli or triggers, alcohol and drug abuse, compulsions and rituals, psychotic-like symptoms including auditory and visual hallucinations, eating disorders. Other symptoms of dissociative identity disorders may include headache, amnesia, time loss, trances, and out-of-body experiences.
While the causes of dissociative identity disorder are still vague, research indicates that combination of environmental and biological factors works together to cause it.
How is dissociative identity disorder diagnosed? Making the diagnosis of dissociative identity disorder takes time. It's estimated that individuals with dissociative disorder have spent 7 years in the mental health system prior to accurate diagnosis. This is common because the list of symptoms that cause a person with a dissociative disorder to seek treatment is very similar to those of many other psychiatric diagnoses. In fact, many people who have dissociative disorder also have secondary diagnosis of depression, anxiety, or panic disorder.
What's the recommended treatment plan for dissociative identity disorder? While there's no cure for dissociative identity disorder, long-term treatment is very successful if the patient stays committed. Effective treatment includes talk therapy or psychotherapy, medication, hypnotherapy, and adjunctive therapy such as art or movement therapy. Because oftentimes, the symptoms of dissociative disorders occurs with other disorders, such as anxiety and depression. Dissociative disorder may be treated using the same drugs prescribed for those disorders. A person in treatment for a dissociative disorder might benefit from antidepressant or anti-anxiety medication.
Andiyan ka na pala ate. Oo, kanina pa. Bakit? Ang daming ginawa namin sa school. Grabe, nakakapagod. Ate, ang sakit ng sarap ko. Oh, tapos, kahapon, ulo. Ngayon, tiyan. Iba-iba nararamdaman mo. Ano may pinagagawa mong bata ka?
Ewan ko nga po, pati kanina sakit din ng likod ko, hindi ko maibed.
Ano kaya nararamdaman mo na? Hindi kaya may cancer ka na?
Ewan ko, te.
O sige, gusto mo pa-check up natin yan.
Sige, ate.
Samahan kita. Di araw-araw na lang ganyan ka. Pag uwi, puro lagi may sakit. Okay na. Natin yan. Kasi araw-araw na lang iba nararamdaman mo. Ano na kaya ang sakit mo? Kasi naman silang huhula tayo na ang sakit mo. Pa-check up na natin. O sige, mag-aayos na ako. Mag-ayos ka na rin. Dapat mo na yung gamit mo. Tara na. Pa-check up na tayo. Kaya yung sakit mo na yung bata.
Good afternoon, ma'am.
Good afternoon po. Nandiyan po si Dr. Makaspat.
So kayo po yung may appointment sa kanya ngayon?
Opo kami.
Sige po, tuloy po kayo.
Thank you po.
So, sila po yung may appointment sa kayo ngayon?
Good afternoon, Doc.
Good afternoon. Sino pasyente? Anong pangalan?
Makalaya po.
Ilan taon na?
21 po.
Anong mga nararamdaman?
Yun po kasi, asasakit po kasi ng siya ko. Tapos, yung mga nakarang araw po, iba't iba po yung nararamdaman ko. Kapag po nasakit ng likod ko, sakit po ng paa ko. Pero wala naman po masamang nangyayari or wala naman po injury na nangyayari sa akin.
Sige, mag-undergo ka sa test para malaman natin kung ano yung mga nararamdaman mo. Ha? Nurse pa kayo. Medicine.
Good afternoon, Doc. Kami po yung referred ni Dr. Makaspak na pumunta raw po dito sa 517.
Anong pangalan nila? Makalaya.
Makalaya po.
Oo. Napag-aralan ko na yung resulta ng mga test mo na ginawa din nila Dr. Makaspak. Ayon sa resulta ng test, laboratory test, meron kang, nasasuffer ka sa tinatawag natin somatization disorder. Ano ang somatization disorder? Yun yung mga sakit na negatibo lang naman yung resulta. Lahat ng sakit na yun ang gagaling lang sa pag-iisip mo.
Ano po ba yun, Doc? Kasi pag sinabi natin, di ba, pag pinapunta sa psychiatrist, medyo may mga diferensya na yung mga tao na yun. Ano po ba yung ano ng kapatid ko?
Kailangan lang talaga ni Miss Makalaya mag-undergo sa tawag natin therapy, which is tinatawag natin cognitive behavioral therapy. So, kailangan simulan natin agad para hanggat maaga pa, mag-prevent na natin yung disorder na nararanasan niya.
Isa po pala yung disorder. So, mga ilang months po or bago makaka-recover yung isang tao?
Depende kung makikipag-cooperate sa atin si Miss Makalaya sa gagawin natin therapy.
Is that she has multiple symptoms affecting multiple organs. And that is what's essential of the somatization disorder. So these are disorders typically seen in women, usually young women, and it's inversely related to their socioeconomic status. There might be some genetic loading, and an interesting feature has been that the relatives who are male of women who have this disorder tend to have the antisocial personality disorder, whereas the female relatives tend to be diagnosed with the histrionic personality disorder. Now, the presenting features of this disorder is many physical symptoms affecting many organs. There's no medical explanations. These individuals have long, complicated medical histories, and because of all these constant complaints, you know that it has to affect their personal lives. And the way to make the diagnosis is that you need to have 8 or more symptoms, and that is 4 pain, 2 GI, 1 sexual, and 1 pseudo-neurological. These individuals will basically seek out treatment anytime they can, and they usually have other disorders. For example, because of their symptoms, they probably abuse drugs. Because of their symptoms, they probably have depression. They probably have some underlying personality disorders or other anxiety disorders as well. The way to treat these patients is not to send them to different kinds of specialists or anything like that. You need to have a primary care physician handle the patient. So one identified treater is the treatment of choice. Always see them on a regular basis, because even though you don't find anything now, who's to say that 1 month, 2 months, 6 months, 1 year from now, you will not find some other kind of real disorder. So monthly, brief visits is usually the correct answer. And slowly you try to have the patient understand what is going on and get them to have some sense of awareness as to where these symptoms are coming from. As far as the medical differentials, there are numerous things that you must consider, and always rule out before you finally say that the patient has somatization disorder. This includes myasthenia gravis, lupus, it could be AIDS, it could be infections, it could be anything like multiple sclerosis, thyroid disease. From a psychiatric point of view, it could be due to depression, it could be substances, or it could be just pure anxiety disorders which are triggering these somatic complaints.